Hello, my name is Tina Smoljan and I'm a professor at the Medical High School Pula. Have you ever heard of empathy? Is empathy similar to sympathy? Can it be learned? Researchers say that there are 43 different definitions of empathy, but there is a simple sentence that can describe it: sharing of another being's emotions. It is in our core. Even newborn babies cry reflectively when they hear another infant cry. Despite it being innate, the quality and level of human empathy can vary, but it can be learned. For medical staff, empathy is a very important skill because it can improve the healing process of a patient. We have to imagine how the patient actually feels in his situation during his or her illness. See the world through the patient's eyes, not through our own. Do not judge. Appreciate patients as human beings. A lot of studies have shown that approaching the patient with empathy while treating the disease can result in better therapeutic outcomes. When patients are in pain, agony, depressed or aggressive, having someone to understand their feelings and behavior can be extremely soothing. The burden is not heavy anymore, and they are safe to express their feelings and problems and motivated to continue their treatment and listen to your instructions. Patients with cancer who receive empathetic nursing care show less stress, depression, and aggressiveness. Mothers who have empathetic midwives have lesser degree of stress, agony, and pain. And also patients with diabetes have a more positive therapeutic outcomes. We know it is difficult to empathize when you are overworked, tired, and lacking time to concentrate fully on a single patient. But this is why good education in empathy is a needed starting point. Also, empathetic listeners can develop compassion fatigue due to prolonged exposure to stress. Therefore, it is important for you to learn to avoid that with different techniques. Can students learn to be more empathetic? Of course. Hands-on work, communicating with patients, role-playing activities, experiential learning, journaling, etc. Those are some of the practices that can help you become an even more empathetic and efficient professional. To conclude, you have to have the will to be empathetic, and this will open the door to the lifelong learning of empathy.